Good afternoon, everyone, and welcome to another segment of Kerrville Clips. I'm City Council Member Judy Eychner, and today we're visiting with Peterson Regional Medical Center's first Chief Medical Officer, Dr. Mack Blanton. Thank you for being with us, Dr. Blanton. We've had another Dr. Blanton in our community for a long time. Any possibility you're related to him?
Yes, thank you for asking. That's my Uncle Gene Blanton. He was affiliated with Tybee School District and Tybee High School for many, many years there. And Gene had four Blanton boys, and my dad, Sam, who was Gene's younger brother, had 5 Blanton boys. We grew up in Beaumont, so I remember as a kid coming to Kerrville and running the hills of Kerrville with my cousins here many, many years ago, back in the 60s actually. So fond memories of Kerrville.
Oh, that is neat. Well, your uncle was very, very much thought of.
Well, thank you so much. I think a lot of Uncle Gene as well. I call him Uncle Gene. You'll probably know him differently there, but that's what I call him.
Well, that is neat. Well, I understand that you are the first Chief Medical Officer at Peterson, and we don't say Peterson. We say Peterson Medical, I believe, or Peterson Hospital. No.
We call it Peterson Health because it's
right.
More than a hospital, it's a health system there. So it's the hospital, which most people think of as the brick and mortar, so to speak, hospital. But we have clinics scattered about and rehabilitation facilities and ambulatory care center and that kind of thing, urgent care clinic there. So it's really a health system there. So Peterson Health, I think, is the way I would recommend people think of it.
Well, I always want to say Peterson Hospital, but I
said Peterson Memorial.
That's right. That's
right.
Right.
I remember that.
Yes.
There,
And tell us a little bit about your background and how you got here.
Yeah, so I'm a Texan, grew up in Beaumont, Texas, Southeast Texas, and went to Texas A&M University to get my undergraduate degree. Then I got accepted into medical school, and unfortunately the only medical schools at that time were University of Texas schools, so I had to go to University of Texas.
Doggone.
Yeah, my family wasn't happy. I come from a long line of Aggies there, but very proud to be a University of Texas graduate as well. And after I graduated from medical school, went to the military and did my internship and residency and fellowship in internal medicine and pulmonary and critical care medicine at Brooke Army Medical Center in San Antonio, Texas. Had a long career in the military, total of 27 years in the military as a physician, and retired. And so I'm in my second career now, and have been doing physician leadership type positions for about the past 6 or 7 years there. So.
Oh, well, thank you for your service.
Thank you.
And it's good to be back home, right?
It's great to be back there, yeah. I did a little stint in Indiana at Deaconess Health System. It's a very large health system in Indiana, and I was their chief medical officer for 3 years. Great experience. Indiana is actually a great state, but there's no state like Texas, I'll tell you.
Amen.
And it felt like I was coming home, and then my ties to Kerrville really made me feel like I was coming home here.
So how long have you been here now?
3 months.
3 months.
Yes.
So you still getting your feet wet? Right?
Yeah, I came here and started in February, and next thing I know, we have the COVID-19 pandemic, and so my background in pulmonary critical care kind of positioned me very well for helping Peterson Health deal with the COVID pandemic, because a big part of the COVID-19 infection is lung related and critical care related. So I jumped right in, and it was blessing and a curse. It was tough coming into a new job and then having to deal with that, but it actually caused me to integrate much more rapidly and get to know the system and the people and the community much more rapidly than I probably otherwise would have
yes.
been able to.
Yes. Well, it would have to be interesting coming in with that and
yes.
everything being brand new.
Yes.
Well, that's what we would like to visit with you about today.
Certainly.
And I find this very interesting. There's so much information out there Nobody knows really what is the real stuff and what isn't. So hopefully you'll be able to shed some light on some of these questions.
Yes.
A couple months ago, when Peterson first began the testing for the COVID-19, we were talking about it, and of course, can you tell us what type of testing for the virus that you are doing right now?
Yeah. So there's two basic types of tests for the virus. And the one that most people think about is what I would call a diagnostic test. It's a test that tells you, do you have active infection with COVID-19 or not? And that's a test, we call it a molecular test or a nucleic acid test. And it's a test that picks up on the actual fragments of the virus that are in the nose and back of the throat there with a swab there, and a specific type of lab methodology tells us if it's COVID-19 or not there. And it's pretty specific for that virus. In other words, if it's positive, you can feel fairly assured that it's a positive test. We've been doing that test since early on. Initially, we were sending the test to the state department laboratories there, and they were so overwhelmed initially with testing from all over the state that the turnaround time was pretty slow, about a week or even longer sometimes. And then we discovered that a local laboratory here in Kerrville, CPL, which does this same type of test, that we established a relationship with them, and they gave us a 24-hour turnaround time with that test there, which was great. And then we at Peterson have recently acquired capability of doing that type of test in-house in our own laboratory, where we have a 45-minute turnaround time there. And we've just gotten this capability within about the past week. We've been in the key, so to speak, for it with this company for probably 4 to 6 weeks. And they've been, just struggling to get the test out to people who needed it there. But we finally made our cut there and got our kits there. So we have those kits available at Peterson Health now. So we can test patients with a diagnostic test for COVID-19 with a nasal swab and have results back within about 45 minutes.
Wow, I was going to ask you how long it took.
Yeah. The other type of test is you see things in the media there and in the press about the antibody test. There was a lot of talk about the antibody test there, and we have that capability. We acquired it early on when it first became available because we wanted to make sure that we were really at the tip of the spear, so to speak, in providing what was needed for this community there. And so we acquired the antibody test early on. An antibody test is a test that shows you if you have been exposed to the virus and have established an immune response to the virus. And it measures what's called IgG, immunoglobulin G, in the blood. This is a blood test, so we have to draw a blood sample to do this test there. But it doesn't tell you if you are actively infected with the virus. So if you have a positive antibody test, all it tells you is you've been exposed to the virus and your body has established an immune response to the virus and has created this immunoglobulin G, IgG, that is specific for that virus there. So we have that capability, but when we started looking at the utility of it in our community, it was clear to us that it wasn't really something that we needed to do widespread. It's better actually for people doing what are called epidemiologic studies on large populations to see what the incidence of COVID-19 is in a population, or maybe for somebody who had the infection and maybe wants to donate. You've probably heard of donating the convalescent plasma for treatment there. So those who have had the COVID-19 and it's behind them, we can measure their antibodies with this test to tell us whether or not they'd be a good donor of plasma there. And the other utility for this antibody test is in the vaccine studies. There, when you give a vaccine, what we're measuring to show that the vaccine works is this antibody, this IgG antibody, to see if the vaccine generates a high quantity of this IgG antibody in your bloodstream. So that's the utility of that test. So it doesn't really help us in diagnosing an active COVID patient. So we've done over 1,000 tests in Kerr County now, and between us at Peterson, we've done about 800, and then the National Guard, as you know, has come in and done over 200 tests. We have 10 positives out of that 1,000 plus tests done. So our incidence or positivity rate in our community is pretty low, and I think we can feel comforted by that, Judy.
Is there anything that in particular that you would attribute that to?
Well, I think, first of all, I think our nursing homes, our long-term care facilities in this community took action early on when they started seeing, like in Washington State, and they had an outbreak early on, you may remember, where
yes,
a lot of people died. 40 plus people died, and that was out of a nursing home. And then as we've gotten further into this pandemic, it's become clear that nursing homes are the most vulnerable and most at risk. So I think our long-term care facilities took great interest in that and started locking down, so to speak, with visitation and hand washing and masking and that kind of thing early on, as did our community, I believe. Because if you look around us, we're surrounded by a big metropolitan area, San Antonio, that has a lot of cases, and Austin with a lot of cases, and actually counties surrounding us
that you have, yes,
that have considerably more than us. Kendall, Bandera,
yes,
Mason.
Kerrville County has a lot.
Yeah.
Not so far away.
Yeah, so I think our community leadership did the right things, and our nursing homes did the right things. And Peterson, I will tell you, when we first heard of this back in early February, we have been preparing for it with establishing large stockpiles of protective equipment, personal protective equipment, PPE, like you've heard of, with N95 masks and gowns and surgical masks and gloves. So we were well prepared from early on in our preparation for this.
So, so you told us how long it takes to get the results back, and you have tests right now. We also have the National Guard coming in to do testing. Can any of the physicians in their own office do this test?
Yeah, certainly. Yeah, any physician can put in an order for the test, so to speak, and I think you're aware that we established what we call the Outreach Testing Center, which was initially a drive-through capability. Now we've transitioned that to our urgent care clinic, where you can drive up and get a test. If a physician wants to order that, we can do it there. They can do the swab actually themselves and put it in the transport media and send it to the lab, same lab that we do as well. So any physician can order the COVID-19 test.
But in our community, in order to get the test, you do have to have a doctor who has requested it.
It requires a licensed independent practitioner, doctor or advanced nurse practitioner or physician's assistant to officially order the test. Yeah.
Okay.
Now there is a move in big metropolitan areas. In fact, I think San Antonio is allowing testing for much broader testing for people who don't have even symptoms or exposure or travel history for COVID-19, just to kind of like a lot of places are doing, just trying to broad brush test everybody just to get an idea of how prevalent the COVID-19 is in the community.
So the two tests each reveal something differently. You explained that.
Yes.
And if it's positive, does that mean that a person is immune?
For the antibody test, all it means is they've developed an immune response. Their immunity, it probably means they're immune. We cannot say that for sure yet. When we look at prior epidemics of coronavirus back a decade or so ago, the SARS, severe acute respiratory syndrome epidemic, it didn't become a pandemic, and the MERS, the Middle Eastern respiratory syndrome. Those are both coronaviruses, very similar to this one. They stayed local, so they were epidemics, not pandemics there. But we've learned from them, and we are extrapolating, so to speak, or inferring from those epidemics what immunity might look like from COVID-19 there.
We talked a little bit about that we have fewer than anybody else around. What do you see the future for testing at?
Yeah, so the newest thing on testing came out about a week ago. The FDA, the Food and Drug Administration, released what's called a EUA, Emergency Usage Authorization. You see a lot of that with the pandemic now, that FDA and CDC are using these emergency usage authorizations, which you normally would not see them allowed to do unless there was a crisis, a pandemic. But the FDA approved a test called an Antigen Test, which is different from the other two tests I just talked to you about. The Antigen Test will be used more for, it's good for mass screening. It's very similar to the testing platform you may have heard of, like a rapid strep test, where you can swab a child's throat there, and within minutes it'll tell you if they have strep throat or not. And so that's a good screening test. So you can do that in a clinic, or just large volume screening there. That test is coming. It's not widely commercially available yet, but it will be there. So that's coming, the antigen test. More rapid screening test, for instance, Abbott Laboratories, which is a very large company that's international, actually has a rapid test also that is the same type of test that we use now, but you get results within about 15 minutes, less than 15 minutes. It's the one you may have heard the president talk about in their task force briefings. When he first had the test, they put the swab in. Yeah, he said they took a ride at his pituitary gland and headed over to the left ear. But this one is a little swab in the nose, and then the test results in about 15 minutes there. That one's out there and available. There's been some concerns about what are called false negatives with that test. In other words, you do the test and the patient actually has COVID-19, but it tells you that it's negative. So that's a false negative test. And so they're sorting that out before that becomes widely available there. But we're going to broadly expand testing where we can screen large numbers of people there. I think that's key. And as we open Texas and start getting back to normal there, which will be the new normal, as you know, I think the capability for testing, because if we have somebody who is positive, then we can identify them, and then we can look at who they were in contact with and try to create controls around that to prevent, just wider and wider spread there. So I think that's, the way we need to head is more rapid testing and more broad testing.
Will it get to the place where I can go into the drugstore and get the test and do my own swabbing and send it off? Yeah,
it's funny you say that, because it was just announced today that the FDA approved another company to do that very type of test. It's a home kit there. It's like pregnancy test, where you can just go and buy a pregnancy test and go home and, there it is. There. So yeah, that was just announced under an EUA, Emergency Usage Authorization, for another company, that their whole book of business is home testing there. And so they now have a home test kit for COVID-19 there. And once again, this is just announced, so it'll take a while before it's widely available in the communities across our country.
Very interesting. Is there anything else that you would like to share that we have not mentioned about the testing, about the maybe the disease in general?
Yeah, we're learning every day. In fact, all the medicine literature that I look at, every article is something to do with COVID. There, it's just amazing there. So we're learning. So this time next year, we will know much more about COVID-19, and hopefully, if all things go well with the vaccine programs that are in place, we'll have some vaccine capability available soon there. As we open Texas there, I think we all just need to be aware that it's still around us. It's still in our midst.
Still
there. And as we track on the instance, the positivity rate in the Kerrville community, I think if we notice it going up, rather than, as I mentioned, it's actually going down because the numbers of positives as opposed to the numbers tested has been, a decrease instance. If we start seeing that go up, I think maybe we need to reevaluate what we're doing and see if we might need to take a step back or not. But I think opening up and everybody understanding social distancing and just being aware and washing your hands.
We can't give that up.
We can't give that up. Yeah, that's the new normal, I call it.
And I think as you watch people, I feel just personally, you open it up and you have beautiful days. The weather that we're experiencing here, it's just hard to believe that we still have to do that.
Yeah.
And
it's not human nature.
No.
There, especially Texans there. So
that's right.
Yeah.
Exactly. I always hate the question that reporters ask. When do you think there's going to be a vaccine for this? Any thoughts on just? And I realize you don't have the crystal ball. So any thoughts on that?
Yeah, vaccines. Before COVID-19 took months to 2-3 more years to develop vaccines. But you've seen what our country has done in a response, and when you throw in industry and these wonderful companies that we have in our country with the brilliant minds and scientists behind it, and then through all the impact that our country brings to bear, I think we'll have a vaccine, honestly, if not by end of year, early part of next year there. So that's my hope there. We'll see how things work out there, but I'm confident that we'll have a vaccine pretty soon, Judy.
That's good. Well, I appreciate the information. We appreciate what you and the hospital are doing. I know that for me, and I think for the rest of the community, it's just a really warm, fuzzy feeling knowing that we've got all of you over there doing what you're doing. And we just totally appreciate it. But I think we still need to remind the community, don't take anything for granted. And keep wearing those masks and washing those hands and being safe and treating other people the same way.
Yeah, that's key.
So, well, thank you for all that you do, and we're glad to have you on board, and glad to have another Dr. Blanton in the community.
Thank you, Judy.
This is great.
It's
thank
great
you
to be
for
back
your
in
time.
Texas. Thanks so much.